Good morning. Today we are going to start the chapter Drugs. First, drugs and their classification. Drugs are chemicals of low molecular masses. These interact with macromolecular targets and produce a biological response. When the biological response is therapeutic and useful, these chemicals are called medicines and are used in diagnosis, prevention, and treatment of diseases. Most of the drugs used as medicines are potential poisons. If taken in doses higher than those recommended, use of chemicals for therapeutic effect is called chemotherapy. Classification of drugs. Drugs can be classified mainly on criteria outlined as follows. First, on the basis of pharmacological effect. This classification is based on pharmacological effect of the drugs. It is useful for doctors because it provides them the whole range of drugs available for the treatment of a particular type of problem. For example, analgesics have pain-killing effect. Antiseptics kill or arrest the growth of microorganisms. On the basis of drug action, it is based on the action of a drug on a particular biochemical process. For example, all the antihistamines inhibit the action of the compound histamine, which causes inflammation in the body. There are various ways in which action of histamines can be blocked. On the basis of chemical structure, it is based on the chemical structure of the drug. Drugs classified in this way share common structural features and often have similar pharmacological activity. For example, sulfonamides have common structural features. On the basis of molecular targets, drugs usually interact with biomolecules such as carbohydrates, lipids, proteins, and nucleic acids. These are called target molecules or drug targets. Drugs possessing some common structural features may have the same mechanism of action on targets. The classification based on the molecular target is the most useful classification for medicinal chemists. Drug target interaction. Macromolecules of biological origin perform various functions in the body. For example, proteins, which perform the role of a biological catalyst in the body, are called enzymes. Those which are crucial to communication system in the body are called receptors. Carrier proteins carry polar molecules across the cell membrane. Nucleic acids have coded genetic information for the cell. Lipid and carbohydrates are structural part of the cell membrane. We shall explain the drug-target interaction with the example of enzymes and receptors. Enzymes as drug targets. First, catalytic action of enzymes. For understanding the interaction between a drug and an enzyme, it is important to know how do enzymes catalyze the reaction. In their catalytic activity, enzymes perform two major functions. First, the first function of an enzyme is to hold the substrate for a chemical reaction. Active sites of enzymes hold the substrate molecule in a suitable position so that it can be attacked by reagent effectively. Substrate bind to the active site of enzyme through a variety of interactions such as ionic bonding, hydrogen bonding, van der Waals interaction, or dipole-dipole interaction. Second function of the enzyme is to provide functional groups that will attack the substrate and carry out chemical reaction. Drug enzyme interaction. drug inhibit any of the above mentioned activity of enzymes. These can be block the binding site of enzymes and the uh, prevent the binding of substrate or can inhibit the catalytic activity of the enzyme. Such drugs are called enzyme inhibitors. Drugs inhibit the attachment of substrate on active site of enzymes in two different ways. First, drugs can compete with the natural substrate for their attachment on the active sites of enzyme. Such drugs are called competitive inhibitors. Second, some drugs do not bind to the enzyme's active site. These bind to a different site of enzyme which is called allosteric site. This binding of inhibitor at allosteric site changes the shape of the active site in such a way that substrate cannot recognize it. If the formed bond formed between an enzyme and an inhibitor is a strong covalent bond and cannot be broken easily, then the enzyme is blocked permanently. The body then degrades the enzyme inhibitor complex and synthesizes the new enzymes. Receptors as drug targets. Receptors are proteins that are crucial to body's communication process. Majority of these are embedded in cell membranes. Receptor proteins are embedded in the cell membrane in such a way that their small part possessing active site projects out of the surface of the membrane and opens on the outside region of the cell membrane. In the body, message between two neurons and that between neurons to muscle is communicated through certain chemicals. These chemicals, known as chemical messengers, are received at the binding site of receptor proteins. To accommodate a messenger, shape of the receptor site changes. This brings about the transfer of message into the cell. Thus, chemical messenger gives message to the cell without entering the cell. There are a large number of different receptors in the body that interact with the different chemical messengers. These receptors show selectivity for one chemical messenger over the other because their binding sites have different shape, structure, and amino acid composition. Drugs that bind to the receptor site and inhibit its natural function are called antagonists. These are useful when blocking of message is required. These are other types of drug that mimic the natural messenger by switching on the receptor. These are called agonists. These are useful when there is a lack of natural chemical messenger. Therapeutic action of different classes of drugs. In this section, we shall discuss the therapeutic action of few important classes of drugs. Antacids. Overproduction of acid in the stomach causes irritation and pain. In severe cases, ulcers are developed in the stomach. Until 1970, only treatment for acidity was administration of antacid, such as sodium hydrogen carbonate or a mixture of aluminium and magnesium hydroxide. However, excessive hydrogenate carbonate can make the stomach alkaline and trigger the production of even more acid. Metal hydroxides are better alternatives because of being insoluble. These do not increase the pH above neutrality. These treatments control only symptoms and not the cause. Therefore, with these metal salts, the patient cannot be treated easily. In advanced stages, ulcer became life-threatening and its only treatment is removal of the affected part of the stomach. A major breakthrough in the treatment of hyperacidity came through the discovery according to which a chemical, histamine, stimulates the secretion of pepsin and hydrochloric acid in the stomach. The drug cimetidine tegamet was designed to prevent interaction of histamine with the receptors present in the stomach wall. This resulted in release of lesser amount of acid. The importance of the drug was so much that it remained the largest selling drug in the world until the another drug, ranitidine, was discovered. Antihistamines. Histamine is a potent vasodilator. It has various functions. It contracts the smooth muscles in the bronchi and gut and relaxes other muscles, such as those in the walls of fine blood vessels. Histamine is also responsible for nasal congestion associated with common cold and allergic response to pollen. Synthetic drug Brom- brompheniramine and terfenadine act as antihistamines. They interfere with the natural action of histamine by competing with histamine for binding sites of receptors, whereas histamine exerts its effect. Now, the question that arises is, why do above mentioned antihistamines not affect the secretion of acid in stomach? The reason is that anti allergic and anti acid drugs work on different receptors. Neurological active drugs. First, tranquilizers. Tranquilizers and analgesics are neurologically active drugs. These affect the message transfer mechanism from nerve to receptor. Tranquilizers are a class of chemical compounds used for the treatment of stress and mild or even severe mental diseases. These relieve anxiety, stress, irritability, or excitement by inducing a sense of well being. They form an essential component of sleeping pills. There are various types of tranquilizers. They function by different mechanisms. For example, noradrenaline is one of the neurotransmitters that plays a role in mood changes. If the level of noradrenaline is low for some reason, then the signal sending activity becomes low and the person suffers from depression. In such situations, antidepressant drugs are required. These drugs inhibit the enzymes which catalyze the degradation of noradrenaline. If the enzyme is inhibited, this important neurotransmitter is slowly metabolized and can activate its receptor for longer period of time, thus counteracting the effect of depression. Iprionazide or phenylazine are two such drugs. Some tranquilizers, namely chlorodiazepoxide and meprobamate, are relatively mild tranquilizers suitable for relieving tension. Equanil is used in controlling depression and hypertension. Derivatives of barbituric acid with veronal, amytal, nambutal, luminal, and seconal constitute an important class of tranquilizers. These derivatives are called barbiturates. Barbiturates are hypnotic, that is, sleep producing agents. Some other substances used as tranquilizers are Valium and serotonin. Analgesics. Analgesics reduce or abolish pain without causing impairment of consciousness, mental confusion, incoordination, or paralysis, or some other disturbances of nervous system. These are classified as below: non-narcotic, non-addictive analgesics, or narcotic या addictive analgesics. Non-narcotic, non-addictive analgesics. Aspirin and paracetamol belong to the class of non-narcotic analgesic. Aspirin is the most familiar example. Aspirin inhibits the synthesis of chemicals known as prostaglandins, which stimulates inflammation in the tissue and cause pain. These drugs are effective in relieving skeletal pain, such as that due to arthritis. These drugs have many other effects, such as reducing fever, antipyretic, and preventing platelet coagulation because of its anti blood coating action. Aspirin finds use in prevention of heart attacks. Narcotic analgesics. Morphine and many of its homologs, when administered in medical doses, relieve pain and produce sleep. In poisonous doses, these produce stupor, coma, convulsion, and ultimately death. Morphine narcotics are sometimes referred to as opiates since they are obtained from opium poppy. These analgesics are chiefly used for the relief of post-operative pain, cardiac pain, and pains of terminal cancer and in childbirth. Antimicrobials. Disease in human beings and animals may be caused by a variety of microorganisms such as bacteria, virus, fungi, and other pathogens. An antimicrobial tends to destroy, prevent, development, or inhibit the pathogenic action of microbes such as bacteria, antibacterial drugs, fungi, antifungal agents, virus, antiviral agents, or other parasites, antiparasitic drugs selectively. Antibiotics, antiseptics, and disinfectants are antimicrobial drugs. Antibiotics. Antibiotics are used as drugs to treat infections because of their low toxicity for human and animals. Initially, antibiotics were classified as chemical substances produced by microorganisms, bacteria, fungi, and molds that inhibits the growth or even destroy microorganisms. The development of synthetic methods has helped in synthesizing some of the compounds that were originally discovered as products of microorganisms. Also, some purely synthetic compounds have micro antibacterial activity and therefore definition of antibiotic has been modified. An antibiotic now refers to a substance produced wholly or partly by chemical synthesis, which in low concentration inhibits the growth or destroy microorganisms by preventing in their metabolic processes. The search for chemicals that would adversely affect invading bacteria but not the host began in the 19th century. Paul Ehrlich, a German bacteriologist, conceived this idea. He investigated arsenic-based structures in order to produce less toxic substances for the treatment of syphilis. He developed the medicine arsphenamine known as salvarsan. Paul Ehrlich got Nobel Prize for Medicine in 1908 for this discovery. It was the first effective treatment discovered for syphilis. Although salvarsan is toxic to human beings, its effect on the bacteria Cyprochet, which causes syphilis, is much greater on human beings. At the same time, Eric was working on azodies also. He noted that there is a similarity in structure of salvarsan and azodies. The arsenic double bond arsenic linkage present in arsphenamine resembles the nitrogen double bond nitrogen linkage present in azodies in the sense that arsenic atom is present in place of nitrogen. He also noted tissue getting colored by dyes selectively. Therefore, began to search for the compounds which resembles in the structures to exotize and selectively bind to bacteria. In 1932, he succeeded in preparing the first effective antibacterial agent, Prontosil, which resembles in the structure to the compound salvarsan. Soon it was discovered that in the body, Prontosil is converted to a compound called sulfanilamide, which is the real active compound. Thus, the sulfa drugs were discovered. A large range of sulfonamide analogues was synthesized. One of the most effective is sulfapyridine. Despite the success of sulfonamides, the real revolution in antibacterial therapy began with the discovery of Alexander Fleming in 1922 of the antibacterial properties of a penicillium fungus. Isolation and purification of active compounds to accumulate sufficient material for clinical trials took 13 years. Antibiotics have either cidal effect or a static effect on microbes. A few examples of the two of the antibiotics are as follows: bactericidal penicillin, aminoglycosides, ofloxacin, bacteriostatic tetracycline, chloramphenicol. The range of bacteria or other microorganisms that are affected by a certain antibiotic is expressed as its spectrum of action. Antibiotics which kill or inhibit a wide range of gram positive and gram negative bacteria are said to be broad spectrum antibiotics. Those effective mainly against gram positive or gram negative bacteria are narrow spectrum antibiotics. If effective against a single organism or disease, they are referred to as a limited spectrum antibiotics. Penicillin G has a narrow spectrum. Ampicillin, amoxicillin are synthetic modifications of penicillins. These have a broad spectrum. It is absolutely essential to test the patients for sensitivity to penicillin before it is administered. In India, penicillin is manufactured at the Hindustan Antibiotics in Pimpri and in private sector industry. Chloramphenicol, isolated in 1947, is a broad spectrum antibiotic. It is rapidly absorbed from the gastrointestinal tract and hence can be given orally in case of typhoid, dysentery, acute fever, certain form of urinary infections, meningitis, and pneumonia. When comycin and ofloxacin are the other important broad spectrum antibiotics. The antibiotic dicidezirine is supposed to be toxic towards certain strains of cancer cells. Antiseptic and disinfectants. Antiseptics and disinfectants are also chemicals which either kill or prevent the growth of microorganisms. Antiseptics are applied to the living tissue such as wounds, cuts, ulcers, and diseased skin surfaces. Examples are furesine, soframycin, etc. These are not ingested like antibiotics. Commonly used antiseptic Dettol is a mixture of chloroxylol and terpinol. Bithionol, the compound is also called bithionol, is added to soaps to impart antiseptic properties. Iodine is a powerful antiseptic. Its 2-3% solution in alcohol water mixture is known as tincture of iodine and it is applied on wounds. Iodoform is also used as an antiseptic for wounds. Boric acid in dilute aqueous solution is weak antiseptic for eyes. Disinfectants are applied to inanimate objects such as floors, drainage system, instruments, etc. Same substance can act as an antiseptic as well as disinfectant by varying the concentration. For example, 0.2% solution of phenol is an antiseptic while its 1% solution is disinfectant. Chlorine in the concentration of 0.2 to 0.4 ppm in aqueous solution and sulfur dioxide in very low concentrations are disinfectants. Anti Anti-fertility drugs. Antibiotic revolution has provided long and healthy life to people. The life expectancy has almost doubled. The increased population has caused many social problems in terms of food resources, environmental issues, employment, etc. To control these problems, population is required to be controlled. This has led to the concept of family planning. Anti-fertility drugs are used in this direction. Birth control pills essentially contain a mixture of synthetic estrogen and progesterone derivatives. Both of these compounds are hormones. It is known that progesterone suppresses ovulations. Synthetic progesterone derivatives are more potent than progesterone. Norethindrone is an example of synthetic progesterone derived mostly widely derivative most widely used as anti-fertility drug. The estrogen derivative which is used in combination with progesterone derivative is ethinyl estradiol and novesterol. Hence this was our chapter. Thank you.